We know that obstructive sleep apnea is a huge problem.
I suffer from this thing called sleep apnea, okay? It's a form of snoring, only it's worse.
Increases the risk of high blood pressure, heart disease, stroke, amongst many other things. The diagnosis of obstructive sleep apnea is an AHI of 5 or more. But what happens to patients that have a read of an AHI below 5? Does that mean they don't have a problem?
No.
One of the issues we have in medicine is that we really treat end-stage diseases and categorize diseases as a black and white thing. For example, high blood pressure or hypertension, diagnosis of systolic blood pressure of 130 or higher, diabetes, a fasting blood glucose of 126 or higher, depression, having 5 symptoms associated with depression in the same 2-week period. But what happens before then? What happens if you have 4 symptoms in a 2-week period or 3 symptoms in a 2-week period? What happens if you have a blood sugar of 125 or a blood pressure of 128? Does this mean that you don't have an issue?
No.
In medicine, we really categorize things as an issue or non, or we don't really appreciate them as a problem until they become end stage. So I think this is a huge thing we need to start looking at, is a spectrum of health. And really, instead of looking at disease, let's look at health and how to optimize the human.